cardiovascular technologist works with a physician and healthcare team to diagnose and treat a variety of heart disease. The cardiovascular lab team works to obtain blood flow and pressure information, which is used to determine the cause of the patient's symptoms and how it could best be treated. The cardiovascular technologist prepares the patient and equipment in the operating room, records data, and directly assists the physician during procedures like replacing heart valves or implanting pacemakers to maintain a normal heartbeat. The majority of technologists work in medical and surgical hospitals, but with experience may find opportunities in the cardiology sales force or as educational specialists, training others on new equipment or techniques. Overtime hours may be required in hospitals with emergency treatment capabilities. Technologists generally work 4 to 5 day, 40-hour work weeks. Weekends and holidays are not generally a normal part of the work schedule. If you're interested in becoming an invasive cardiovascular technologist, you should understand the technical standards and emotional maturity required to work in the profession. A 2-year program of study to become a cardiovascular technologist includes hundreds of hours of hands-on training in the field.
Our responsibility is to have the patient on the table, set up our equipment, drip the patient, and then work side by side with the doctor afterwards.
We can either be assisting the cardiologist directly in the surgical procedure, or we can be monitoring the patient from a separate booth, monitoring their hemodynamics, their blood pressure, their O2 saturations. When the patient usually comes in before the procedure, we get them hooked up to the monitors in the holding area, make sure they're comfortable before the doctor comes and explains to them what's going to be done for the day.
It is possible to go into a 4-year program. You can just recently, we had a lady come talk to us about SUNY Empire, which they accept all the credits from Hudson Valley, and you can get your bachelor's there.
Job placement around here, you can go to a lot of different hospitals in the cath lab directly. Albany Med, St. Peter's, Ellis, Samaritan. There's a couple other ones in the area and some south. Job pay varies hospital to hospital, but generally starting as a CVT1 between $15 and $22 an hour.